Hi, this is Brandon with ChiroUp. I want to cover one thing that has radically changed my practice, and that is understanding what positions to put a patient in to get the best results. And I treat a lot of shoulders in my practice, and one of the things that we try to help patients with is getting rid of impingement, because they go from scapular dyskinesis to impingement syndrome to rotator cuff syndrome, and we try to break that continuum as fast as possible. It is extremely important for the rotator cuff to hold the glenohumeral joint down, or the humeral head down, as you're going through abduction. In fact, that humeral head is going to rise up 10 millimeters within the glenoid if it's unopposed by that rotator cuff. That loss of range of motion creates big problems. So one of the things that I've always done in my practice is I've had the arm in full abduction, and I've forced inferior glide at the glenohumeral joint, which is good. However, I learned something new that I think is going to help my patients out more and has changed my practice and my results. And that's placing the shoulder in an open, packed position as I'm providing inferior glide. And as it turns out, an open packed position is the least stable position of that joint. So I bring the arm in about 55 to 70 degrees of abduction. I keep the arm in neutral position. I keep the elbow bent. It just gives me a little better hold on the arm. And then a little bit, about 30 degrees of abduction. And then from that position, I find the acromion. I slide just off the acromion. I've got a webbed interspace that I can hold the arm. It's a very comfortable position. People with impingement syndrome don't like the arm out in that position due to that impingement, due to that pain. So this is a pretty comfortable position for the patient, and I'm going to use my body actually to force a little bit of inferior glide there. It's nice and comfortable for the patient. I don't have them do any kind of contraction. It's a purely passive mobilization, and then I can let the arm drop and then do about 3 sets of 10 repetitions. The more I can provide that inferior glide to the humeral head upon the glenoid, I can promote that range of motion. That's good passively. However, now I need to go into those rotator cuff exercises to strengthen those muscles, to help those rotator cuff muscles pull that humeral head down as we're going through range of motion. It's also important to go through our scapular stabilization exercises. If you notice in the ChiroUp protocols, not only do we do the rotator cuff strengthening, but we also do the scapular stabilization at the same time, because we need to break that continuum, and doing the inferior glide mobilization is an important piece of that. I hope that helps. I know it's very powerful for me in my practice, because now I've got a good hold on the patient, they're very comfortable, and I'm getting the best possible results. Hopefully take a look at the blog, and then also if you look at the condition reference section, you can see all the stats and all the tests associated with this condition. Thanks.